Canadians now have access to a new hotline, which provides suicide prevention services and mental health supports. Faiza Amin is speaking with some of the people behind this project. Faiza, what are you learning today?
Oh, Melissa, and by the way, that number is live right now. The message is if you are anywhere in Canada and you need help, help is available for you. All you have to do is call or text 988 anytime, 24/7, in English, in French, as well as a number of other language. And like I said, across Canada, you can call that number, text that number to get that help. We're inside CAMH here with Dr. Alison Crawford. We were talking about this before the number went live. How big of a moment is this for Canada and the service providers across the country?
It's so critical, and it's so inspiring now to know that people, as you said, they can use those simple numbers, 988, and be connected to a live responder anywhere in the country, anytime they need it. And we have responders, we have partner organizations in every locally, provincially, and territorially, and in every area of Canada.
Walk us through, what can we expect? Somebody texts or calls this number. Walk us through what they'll be on the other line.
So someone live, well, actually first people will get a message letting them know that they're in the right place, and then they also have a few options. So whether they want service in English or French, if they're 18 years or younger, or if they're First Nation, Inuit, or Métis, so they have some specialized options, and then they'll get put through to a responder closest to home, either phone or text.
What impact do you expect this to have on service providers, on people who are looking for mental health supports?
Yeah, so I mean, our primary goal, the primary goal of 988 is to prevent suicide. So we hope that anyone who is struggling will call, and we hope that that prevents suicide. And we know that people are impacted. The people who are thinking about suicide, their families, their communities are impacted, and we want to prevent those kinds of impacts. I think for responders who are answering the calls, these are people across our country who are community members of all ages and backgrounds, and they're really motivated to help, to be a non-judgmental listening ear, and I know they want that ease of connection as well.
Are service providers prepared? Could there be an increase in people seeking out these supports, which is good?
Yeah, absolutely. We want people to call if they need the service, and we'll be there. So we are ready. We have over 1,000 people trained across the country at all of our partner organizations. But we do need people. We will need people as we continue. We'll need volunteers and paid responders, and we're looking forward to welcoming more people to the team as we grow. And we're also going to be learning. You know, this is a new service in Canada, so we're excited.
Perfect. Dr. Alison Crawford, thank you so much for joining us, psychiatrist here with CAMH, and playing such a pivotal role in rolling out this 988 hotline. So Melissa, as I mentioned, this line is ready to go for anybody who needs mental health supports.
988, the number to call or to text. A critical update there from Faiza Amin here on City News 24/7. Thanks for that, Faiza.